Now we've had chance to know.
I agree.
How you. I just got like. That's right. You do that? That's one thing. That's what you do. You reach in and squeeze.
Did you really skate here or is that for a pet?
To,
Did you really skate here or is that for a pet?
No, I see you.
Really?
All right, we'll go ahead and call the meeting to order. If you're joining us via Zoom and you're dialed in on the telephone, you will press *9 to raise your hand and to put your hand down. Whenever you're called upon, you will press *6 to unmute your microphone and *6 again to mute it whenever you're done with your comment. Okay, I will entertain a motion to adopt the agenda.
Motion to adopt the agenda.
Got a motion by Dr. Thompson, a second by Mr. Douglas. All in favor, signal by saying aye.
Aye.
All opposed, that motion carries. New business tonight. We'll be having a discussion and hearing the proposal from Panacea Health Systems to operate all or part of Lakeshore Hospital. For this meeting tonight, the way we're going to go about it is have Panacea present to us, and then board members will have an opportunity to ask questions, get feedback, and then at that point, we will entertain comments from individuals in attendance, whether it be in person or via Zoom. So we do ask that all questions and comments be held until we get to that point after the presentation, after the trustees have had an opportunity to ask their questions. At this point, we will go ahead and turn the floor over to Panacea for their presentation and introduction of everybody that's with us tonight.
Good afternoon. I'm Dr. Ganesh Arora. I'm with Dr. Ravi Kolamanti. We represent Panacea Health System. We want to thank you for giving us the opportunity to work with the Lakeshore Authority about Lakeshore Hospital. You have no idea how excited we are to work with you. This is an opportunity to provide service to local community, which they deserve. I mean, a place like this, they've got to have a hospital where they could deliver the baby. They should have a hospital where they could go and get all the ER work done. You know, this is a community which I personally have worked for several years. I actually have worked with Dr. Thompson even at the radiation oncology facility. And I had my own facility here, Clinical Pet of Lake City, for 7 years. And I was the only one providing PET scan to the patient all over the southern Georgia to many counties in this area. Patients who are coming to Clinical Pet of Lake City to get a PET scan done. So I'm familiar with almost every physician in this community. And Dr. Kolamanti comes with a very unique experience of being an interventional cardiologist, being an entrepreneur, and the cutting edge of a healthcare program he's working on. So we have a plan to work with you on the hospital, how we could revive it in various steps, various phases. We have a team, we have financial resources, we have experience, we have whatever it takes to run this hospital. So I'm gonna invite Dr. Kolamanti to come and make a presentation to you. We'll be happy to answer all your questions. With us is also Dr. Lindo, who's the OBGYN specialist, have 40 years of experience. delivering baby, handling all the pediatric emergencies and OB/GYN emergencies. So, and we have many other physicians who work with us, who are on staff with us, who will be helping us to develop various programs at the hospital. All right, Pallavi, please come.
I'll take my mask off. Is it okay? All right. I'm Dr. Colaventi. Thank you for giving us this opportunity. And I think you have a brief summary of my presentation. Can this become any darker? So a year ago, we were visiting Lake City, and our intention at the time was to look for a place to start a rural health center. Phoenicia Health Systems, we started approximately 2 years ago. And this company, our goal was to start rural health centers, providing care to people that
Can you
in.
speak into the microphone so we can hear you?
Sure. Sure. Can you hear me now?
Much better.
Okay, good. Yeah, Phoenicia Health Systems is a company that we started approximately 2 years ago. In my career, I had several roles. I'm a cardiologist by profession, and most of my life I've spent as a cardiologist. 4 years ago, I had the opportunity to be a medical director for a small rural hospital out in Williston, Levy County, Florida. And during that period, what I found was that even though that was only 20 miles away from Ocala with 2 major hospitals, that place did not have even basic health care. We have tried very hard to get the hospital up and running. And long story short, because of local issues and other things, funding issues, the hospital was finally shut down. And at this stage, in those 3 counties, Levy, Dixie, and the neighboring counties, there are no hospitals. Everybody from there goes to either Gainesville or Ocala. During my term as a medical director, I was invited to build another hospital serving that community. And we started exploring opportunities to build a small rural hospital. And interestingly, last year, or a year and a half ago, Florida State also did not require certificate of need for small hospitals. That was favorable to us. So when we explored it, we found a place called Chiefland, which was in the corner of 3 counties. And we engaged in starting to build a rural hospital there. And at the same time, we also identified 20 or more locations in rural Florida that did not have access to healthcare. And one of the places that we found was outskirts of Lake City. And in fact, I came here at least half a dozen times looking at places to start a rural health center. And during that period, we learned that Lakeshore Hospital Authority and the news that came by. And therefore, we thought this would be very good thing for us to participate in this because it would fit into our plan of getting these rural health centers and probably feed into this. So that is briefly the introduction why I am here today. And so Phoenicia Health Systems is a company that mainly will do rural health centers. Next slide. Next one. Okay. Our team. So that's me on the top. And as I have told you, I'm a cardiologist and mostly spend time in the cath lab and seeing patients. And Dr. Arora, you have just met. He's a radiation physicist. He has extensive experience in imaging centers, radiation therapy for cancer patients. And he also had several practices. In fact, the interesting thing, like he mentioned, his career started in Lake City. Dr. Lindo, he is with me today. He is a very senior obstetrician and gynecologist, currently working at Advent Hospital in Ocala, and we have come to know each other for the past few years. And when I came to this place, one of the things I have learned is that he's somebody that would probably be the most important asset that I'll be bringing to this town. He's an obstetrician that delivers over 600 to 700 babies every year in Ocala, and he has done that for a very long time. I will have Dr. Lindo speak to you just briefly for a minute or two about himself, and then I'll continue. Dr. Lindo.
Good afternoon. It's a pleasure being here. I visited the area once before. Briefly, I'm an OBGYN physician. I've been practicing since, well, I graduated in 1975 and been practicing since. Very active in the Ocala community. My career takes me from New York City, where I was trained OBGYN, Columbia affiliated hospital. From there, I went on to Michigan in a group practice and also as a associate professor at Michigan State Hospital. Moved to Florida in 1990 and been practicing here since. What I noticed about Lake City is the fact that you do not have an OBGYN facility. And if I had my wife or family member in the area, I would be somewhat concerned as it relates to delivery of care for women. Shands, I think, is quite a distance from here. If you have a high-risk patient or someone who goes into preterm labor, there's always the likelihood that that could end in catastrophe trying to get to Shands or any other neighboring facility. I think this is a good opportunity to provide care for the women of the community, not just from the standpoint of obstetrics, but women health in a complete sense. If there's anyone who need to ask me any questions, I'd be willing to do so. Any questions? No? Okay, thank you.
I have a question. Do you know how many cases
We're gonna-
CHS was?
Mr. Wilker. We're gonna wait until they're done with the complete presentation to,
Oh, so there's no question.
it's not right now. That's-
Thank you.
Why don't we take our questions? Why don't we finish the talk? and then-
That's fine with me. Just there.
It should take too long.
Well, thank you, Dr. Lindo. I thought that it was very important that we have the ability to provide these services. So the other thing that I know that you can't see the slides too well. Anyway, in any business, be medical or non-medical, I think it's very important to have financial institutions behind you. And in this day and age, you also need information technology. So the other two members are precisely that. They provide, they're with the private equity funding, as well as in medical informatics. And they will be helping us put this project together. Next one. Next. Okay. So what is my role in this part? One, we will be providing a full service cardiology in this area, which means that we are be putting up a cardiac cath lab. Over the past 2 years, Medicare now allows non-emergency coronaries, elective coronaries to be performed outpatient in a surgical center. And as and when we get the recertification back for the surgery centers here, we should be able to do coronary stenting here, which would save a lot of people from going elsewhere. And that would be something that we will be seeing in the future. And surgical centers, we are also able to do pacemakers, defibrillators, and pretty much full service cardiology. Next slide. Next. Dr. Arora's role will mainly be in developing the radiology program, where we will have full imaging service. Our research shows that more than half of imaging that Columbia residents need, they go to Gainesville for that. And there is only one imaging facility in the entire county, and they can barely meet the need. Simple things like a mammogram, people have to wait for a year to get it done. And some people need it every year, and they have to travel all the way to Gainesville or some other city to get that done at this time. In Columbia County, less than 50% of people have that mammogram annually, whereas in other places, almost 80-90% people have it. So one of the things we will be doing is to add these facilities where people are able to get preventive health. And Dr. Arora also has extensive relationships with physicians in this community. So he will develop an outreach program where we want to make them an integral part of the network. One of the things in medical business, and this has been the focus of the country for the past 10 years, building a primary care network. Right now, in most parts of the country, there is a primary care network existent and thriving. You will be able to find primary care physicians pretty much everywhere. But what they lack is support from specialists. For example, if somebody requires a urologist, from what I heard in this county, most of them have to go to Gainesville to get that service. What our focus will be is to develop this center where we will be providing most of those specialty services locally, so that the network physicians in the community have the ability to and access to these services. Next. Next. Well, one of the founders of our company is Dr. Kondaviti. He is currently the vice president for medical staff at UPMC East in Pittsburgh. And he is semi-retired and he wants to move into Florida like everybody else. And he will be helping us put this together. He has built a 400-bed university hospital. So he comes with extensive experience. Next. 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 Okay. As you have seen in our plan for this place, we think that bringing this back should be done in a phased approach. What I would think is in phase one, which we think will take 6 months to a year from the time we get into contract, we will start the existing hospital just as a walk-in medical center or an urgent care facility, where we will be open for 12 hours of the day. And we will start this facility with 4 days in the week, starting Thursdays through Sundays. Why is that I'm picking that? Most of the urgent care business, when occurs during these weekends and Thursday to Friday, when primary care doctors are not available to their patients. That is one factor. The second factor is a lot of specialists do have business elsewhere, and they may not have enough time to come to Lake City in the beginning when they have small volumes or few patients. What we intend to do is we intend to bring specialists maybe half a day in a month, half a day in a week, and then start them off with some patients, which they'll be easily be able to accommodate during a weekend or during the later part of the week. And as they get busier, they'll be able to dedicate more time to come to Lake City. And our intention is when a patient comes to the walk-in medical center or the urgent care center, we want to have a relationship with the local primary doctors where we send them the patients for follow-up Our intention is not to do primary care or follow those patients, except for indigent patients and otherwise. Those that have other physicians will go back to them. And hopefully, they will in turn get us the specialty work and keep these specialists busy so that they will have an incentive in coming to Lake City. And for that to happen, we'll have to first take an inventory of all the equipment that is currently existent. And we know that some of them are good. A lot of them needs to be updated and upgraded, which we will be doing as a part of this process. Next. As I mentioned earlier, we would eventually be growing to a 7-day-a-week urgent care facility. And if the volumes permit and it is feasible, we will look into having a 24-hour place where we can observe the patients for 24 hours. In a typical hospital, approximately 2/3 of the admissions that we do in a hospital need to stay in the hospital for less than 24 hours. For the most part, we rule out acute emergencies, and they can go back to their doctors or follow up as an outpatient. Only 1/3 of the patients would actually need prolonged hospitalization. If we were able to do a 24-hour observation bed, we will be able to cater to 2/3 of people who come through those doors. Eventually, we will develop transfer agreements with hospitals, either in Gainesville or locally with the HCA. And hopefully we'll have an arrangement where we are able to send some of the sicker patients for admission. As I mentioned earlier, I think the key to success within this facility would be to be able to engage specialists to make it worthwhile for them to come to Lake City. That would require good infrastructure, facilities for them to be able to provide, do procedures here, which in turn will also generate significant revenue for the hospital or the facility. Next. As mentioned earlier, I think one of the key elements is to develop a marketing strategy with social media and local newspapers, having open houses, meeting with people, health fairs, and so on. And we intend to do all of that. Next. Next. Now, once we go past this phase where we generate enough foot traffic to this facility, we would then engage in going to the second phase where we would like to upgrade all the surgical suites, and we will approach AHCA to get us a license to operate as a surgery center. This will help us do procedures within the facility, and we can also get referrals from other doctors to be able to function here. And specialists generally like to go to facilities where they're able to do surgeries and procedures. Next. Next. Okay. Among the specialists that we are currently in discussion with are OBGYN that we just met. The other specialists that we have already engaged and who will be working with us in 2 other locations is a urologist, and we are currently in discussions with an oncologist, a podiatrist, and an endocrinologist. All of them are likely to sign up with us if we were to get this opportunity. Next. 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 Okay. In phase 3, which we think will be in year 3 of this operation, as and when we reach approximately 60 patients per day, once we get to that critical volume, I think we'll be able to get AHCA certification for the ORs and work as a full-fledged surgical center. Next. Next. Now in phase 4, if the authority wants to pursue, we can go back to seeking the hospital license again. And that would be discussed further. And obviously it is much more intense than what I intend to do right now. Next. Now, one of the things that we would definitely do is we have we would like to continue the voucher program that the authority has. And we will continue to honor it, and we will take all the patients that come through the voucher program. However, I have a suggestion. Currently, the voucher program exists for people that are coming with emergencies when they're really sick. I think there is value to giving them some benefits before they get sick. When you engage them for preventive health, the person that's likely not to get sick, not to need those services, and maintain their health, these people are likely to be productive in the society, and they are likely to be gainfully employed. And they will also support their families. So what we propose is developing a program where what I call as medical health plans, kind of like a gym plan, like you go to or for health. So this is somewhat similar to that, where if a person has healthcare needs and they really don't have insurance, we make it very affordable for them to have access to this kind of care. And we have, for that purpose, we have designed this plan to be very affordable. Next slide. And like I said, providing them with care before they get sick, I think has a lot of benefits as listed here. Next. So the membership plans that we have in mind, there are some very basic requirements. One, this is not open for all membership. They have to first go through a screening process with a physician of the facility who determines what is the level of their needs, health needs. Then we obviously are not capable of treating conditions like HIV, patients on dialysis, cancers, so on. These are conditions that are beyond the scope of these plans. So we will also screen these patients for some of these things. Not to say that we won't help them, but it is not feasible to do it within the budget that we are proposing. So we have divided these into three plans. One would be a basic plan. Then there is one for chronic illness, and the other one is advanced management. Next. So in the basic health plan, what we figured is that we will provide these. This is a person who is relatively healthy, has a problem like, say, high blood pressure or high cholesterol, something he's a fully functional individual otherwise, and just requires healthcare periodic checkups. This plan will provide them to have an annual checkup, basic blood work, and prescriptions if they need it. And periodically, they can get refill prescriptions for a very reasonable fee, like $20, $25. And if they do get sick during the year, like get a flu or something, they have access to a doctor. And the cost of that visit would just be $25 at that point. Next. For people who have chronic conditions, such as diabetes or a heart condition or a lung condition, we go by the systems. If they have two system problem, then they would fall into this category where we will charge them $2 per day, which would add up to $720 per year, which is a very reasonable fee. For this, they will get up to 4 visits. They will get the basic blood work and prescriptions, and any additional testing they needed will be discounted, and they will be able to have additional visits for $25 a visit. Next. For people who are sicker than having more than 2 conditions, we have a plan where they'll pay $3 per day, which is $1,095. And they will be able to have 6 visits in a year. And for the most part, most people will not need more than that. But should they need more visits, again, it will be discounted at the same rate. All the testing will also be discounted for people who participate in these memberships. And I think identifying patients, especially the vulnerable ones, and engaging them into these programs will help prevent costly hospitalizations and also disabilities. So I think it will be worthwhile looking into. And that's pretty much all I have. And I'll take any questions that you might have.
Do you have any questions from the trustees?
I just have a few questions.
Yes, sir.
Just to try to wrap my brain around this. So in phase one of your plan, how much of the hospital facilities you need to utilize in phase one?
Phase one will probably be just be using the ground floor for all practical
The
purposes.
ground floor?
Yes,
Okay,
but we do have the lab is on the second floor.
okay,
So we'll probably be using those two floors. The second floor will primarily be used for administrative purposes and the laboratory. And the ground floor will be used for urgent care and ancillary services like the imaging and so on.
and then phase two?
Phase two will involve basically bringing those surgical suites to life.
Okay,
And we will then require some kind of observation beds, which we will either be utilizing the surgical suite itself for that, for prolonged stays. Like I told you, one of the things that the state legislature is considering right now is to reimburse a 23-hour stay in facilities that are not hospitals. This facility can very well qualify for that. Should that happen, we will probably be utilizing some of those beds upstairs or rooms to accommodate that. But that's not likely to happen until we get the ORs running and the full other system running. So I would anticipate that would take us maybe a year or two to get there.
so are you looking at like a compartmental lease? You know, we're gonna, from the authority now, we're gonna lease, we have, I don't know how many square footage we have, but it would be, we lease X amount of square footage at a certain rate. The first
Well, I was
year.
hoping to lease the whole thing and
Okay,
then,
the whole hospital.
and then develop it in phases.
Okay,
And we also have a couple of other parties that I'm sure you are aware too, that there are other parties that are interested in working with us in developing some research facilities and also some memory care units.
so the relationship with the authority would be for the whole, the whole thing.
I would like the whole thing.
Okay, okay.
That's including the outlying buildings as well, not just the main campus.
Yes, sir.
And then, I don't know if you got this far or not, but projections of profitability. Are you asking the authority to cover losses or how are you working it?
I expect to be profitable after the first year, if everything works well.
Okay.
Of course, I can't predict unforeseen things like COVID, but given average medical practice, I have been in practice for 30 years. And of course, you have to.
Yeah.
And I think we can very easily generate enough money to support itself within a year or year and a half.
Okay,
The major expense is going to be in fixing some of the defects that the building has and bringing those ORs back. And so that is where I think we have to engage in a discussion where how you can help us get there. But as far as revenues go, from the patient management standpoint, we are pretty confident and comfortable that we will be profitable in a year and a half or two.
you haven't gotten into any discussions with what the building requires at this point in time, right?
I have a general idea. We had access to what is there available for public to see,
Okay, okay,
and we have reviewed those.
okay,
I have had a couple of my engineers come and look at the building.
okay.
By the way, one of my other proficiencies, I'm a real estate developer.
Okay.
So I develop real estate and we build spec homes and whatnot. So I'm very familiar with the building industry and I have contacts within the building industry. So we have engaged a couple of those people to look into what it might cost. And I have also had the opportunity to look at the estimates that the authority has. I believe we can accomplish all the repairs within a very reasonable budget, probably less than half of what the authority has projected. I'm not promising anything, but it's completely doable, especially if it is done in phases.
I know we'll get into more discussion later, but what term, are you looking for a 20-year lease, a 10-year lease, 30-year lease?
I would like a 10-year lease with the option to renew it. And we would also like, should you ever consider selling this property, we would like a first right of refusal.
So,
Because I will be putting into this a lot of effort, time and money. And we would like to have the privilege of having the first right.
would maintenance of the property and facility go to the leasee or the leaseor?
That is something that we can discuss.
Okay,
I think I would certainly like your help in the first couple of years.
okay,
And after that, once the operation becomes profitable, we can probably take it over in a phased.
Doctor, would you,
thank you.
are you,
No.
are you hoping to replace the current program that we have? Funded private physician outpatient plan with your proposed health membership program? Or are you wanting to maintain what we have and add your membership program as well?
I think we'll maintain your program as it is today. And a couple of things that I found was that the income criteria you have currently, I think is too low. I don't think a lot of people would qualify. That is one issue that I see. The second thing that I see is that a lot of these people are chronically ill, and investing a little money into their health in terms of maintenance, I think would actually prevent them from getting hospitalized, getting sicker and disabled. So I would like the board to look into, is it feasible for you to support them in buying them, say, a healthcare plan that I suggested? That can be in addition to what you're doing. It doesn't have to replace your plan. And our intention is not to replace what you have. In fact, we would like to help you do that to the fullest extent possible.
Would your, will your physicians be qualified to have admitting privileges at Lake City Medical Center, especially during those first few phases, whenever towards?
Well, we are all qualified to get privileges there. Now, to answer that question, let me put it this way. A lot of these privileges come with responsibilities of a call responsibility towards those hospitals. So each individual doctors, for example, Dr. Lindo, will have to look at what is he committing to in terms of their call schedules. Because not only that, we have to engage here and deliver fully what we are taking over. To add that would be a challenge at this stage, because once we get admission privileges there, those hospitals will require us to be on call and things like that. So my answer would be, yes, we would like to get privileges there, as long as it is not a burden to us. We would do that to facilitate our patients to be admitted there and take care of them for continuity of care, which over time I expect to recruit doctors, kind of like a hospitalist, who would probably work here as well as take care of patients and follow up there. I don't see that happening immediately, but I certainly would do that in a year or two once we have a reasonable volume to support their paychecks.
Would you be willing to commit contractually to the 4 phases that you've presented with the operation plan, with provisions, obviously, that are reasonable extensions and modifications that would be approved by the authority?
That is fully my intent. I cannot predict unforeseen things or challenges in the community. You have to keep in mind that I'm a stranger to this community, and how the local physicians will treat me is something that I don't know. And if they treat me well, I don't see a problem in accomplishing this. And we will make every effort to get their goodwill. And like I said, it is my intent that to get all the 4 places together. Now, the hospital, the last phase, is a bit of a challenge, primarily because it's a very expensive proposition. And I don't know how far we will be able to financially commit to that. The first three phases, yes, totally doable. Fourth phase is something that I would not commit to, but I would definitely discuss with you and engage in seeing that it's feasible to do that.
Doctor, could you explain and the fourth phase is
To get the hospital back.
that's inpatient beds, right?
Yes, the hospital back.
So everything else would be outpatient surgery, outpatient clinic, outpatient cardiology, maybe 24-hour observation. bed.
I am pretty certain we will be, by the time this thing takes legs, I think the 23-hour observation bed will be a reality.
But phase 4 is the inpatient, stay
Yes.
3-4 days.
What you had before.
Okay, okay. Full hospital.
Yes.
Now, can I ask another question? Is your
Yes.
facility in Chiefland operational
It will be opening next month.
next month?
The facility in Ocala is operational.
And are we allowed to visit if we ever want to?
You could,
Yeah. Okay.
but like right now with COVID, I don't think there's anything going on there.
Okay, okay, great.
Doctor,
Yes, ma'am.
now, when would you propose opening OB? Which phase?
Well, phase 1, I mean, if depending on how badly you want it. The reason I brought the doctor here is in my visits here over the past 6 months, what I thought was that was really the basic need that the authority is pursuing. And for that to bring in, like, it's a lot of pieces together. Now, as I mentioned earlier, I let Dr. Lindo address that, but I think opening up the birthing center can be done. Now, making that OR functional is a very expensive proposition. Now, if you can fund it, yes, it can be done. By the urgent care itself, what I am proposing, I don't think we'll be able to open up the obstetric OR for at least 2 to 3 years. We won't have enough funds to do that because it would require a surgical team to be on call. It would require an anesthesiologist to be on call. We will need midwives, pediatricians. So it's a whole system that has to come together. And it would be too premature for us to commit to that. But our intent will be to get that going.
Well, the facility at present has 2 birthing rooms. At present, the facility has 2 birthing rooms.
Yes.
So
Are they functional at this time?
they were up until
Yeah.
they closed the doors.
I just want to clarify about the authority. A lot of people think the authority manages healthcare. The authority has a program where we serve indigent patients, financially for reimbursing healthcare facilities. And then we have a building that we, currently own. We're not looking for OB as an authority. You know what I mean? In other words, we're not in that business, just so you understand. We have a building and we have a mission to serve people who are uninsured in our community. So we could continue as an authority board if we had no building. Just so you understand, no.
Well, I should rephrase
Yeah.
what I said. I perceive that as a need
Okay,
here in this community.
yeah, that's probably a better way to say it.
Yeah.
And just some of the things that you mentioned, just so you understand, we had a presentation recently where some of the statistics on OB were that 70% of, prior to closing of the hospital, 70% of people from Columbia County went to Gainesville for their OB even prior to closing of the hospital. So that may give you a little, idea of statistics. And then I know somebody mentioned one imaging, we have 3 imaging places in town. And so, maybe things have changed, since you've been here last or something, but. So just, we're not in that business as an authority, just so we know.
Okay.
We're looking to lease our building.
Yes.
I heard memory care.
Can you expand on that, of what services you're providing with memory care? Forgive me, but I hear.
It is something that has been discussed. When we looked at the facilities, we thought that it would be suitable for a memory care unit. And primarily because it has a full-fledged, it was a hospital, and it has a full-fledged food catering facilities. It has rooms that are suitably, that can easily be converted to memory care facilities. And so that would be, and memory care facilities can support a system very well if it is done right. So one of the ways to bring this back financially would be to do a memory care unit or assisted living facility on one floor.
May I add something to the memory care center? What our goal is to get all the Alzheimer's patients, especially patients who have
No.
mild cognitive impairment.
Could you speak to the mic?
Sure. Our goal is to utilize the current facility we have and make it a real memory care center. Real memory care center requires not only just diagnosing Alzheimer's, also offering the treatment. Some of you may be aware, Biogen company recently got a treatment, IV infusion treatment for treating Alzheimer's disease. But that requires for you to have a true diagnosis of Alzheimer's on a PET brain scan. We just invested into a high-end mobile PET CT scanner, which we will be bringing here to diagnose those patients. And in the memory care center, we'll be able to do infusion. This Biogen compound requires 14 treatments, one treatment every month. And that is very effective treatment for Alzheimer's. In Columbia County and around Columbia County, we have plenty of patients who have cognitive impairment, who have Alzheimer's disease and other part of dementias. Those patients will be handled in memory care center.
Just so I'm clear, which phase are you planning on adding memory care? Or where do you foresee it?
No definite plans yet. Probably in the after a year or so.
I just have another question. So, and I don't know the answer to this. If you can, with your healthcare program that you're proposing, the membership program, can you do that and then accept healthcare insurance, Medicare, Medicaid, and then have a program?
This is not a health plan. It's not an insurance plan.
Okay.
It is kind of like a gym membership. And this will not only be offered to just the authority, we'll be offering it to everybody. And this is besides their insurance. We do not bill their insurance. We do not charge their insurance. This is outside of it. Some people can use it to meet their deductibles if they have a high deductible plan. For example, like a lot of people have this so-called Obamacare. None of them can really get any care because they have to pay the first $6,000 or $7,000. It will be very helpful for those people to utilize this, because if you're a fairly healthy person with Obamacare and all you need is some refill prescriptions, you have to first pay $6,000 before you can get anything. So the intent of these plans is to not replace a health plan, but to help them get some basic needs without breaking the bank.
So it will provide prescriptions also.
Yes, prescriptions, basic blood work, basic things like a physician evaluation, and we can even do telehealth. And only thing that we will do is that, and every service is discounted to a degree when they participate in these health plans. For example, if a CAT scan costs $100, they'll get a 20% discount if they're members in this.
Now, is that operational somewhere else in the state?
Yes, this is a model that I took from Texas.
Okay.
And they do this very successfully.
Where's it modeled in Florida? Where is it modeled?
Florida, I'm not aware.
So it's not in Florida yet?
No, I'm sure there is. But the model that I have picked up is from Texas.
Okay.
And this does not replace, I don't want anybody to misunderstand this. This is not an insurance plan. It does not replace or supplement your current insurance. This is kind of like paying for your cable bill and having additional things. So you can have premium channels on your cable. This is kind of like that. It is not intended to replace your basic healthcare. It is not intended to replace your health plans.
Okay. But it hasn't been vetted yet in the state of Florida, right? as far as it-
I am not aware if somebody is
Okay.
doing it. Down south in Miami,
Okay,
there are a few places that operate as what is called as cash clinics,
yeah,
and they do that. But then those facilities do not see anybody with, they don't take any insurances at all.
how does the authority be held harmless in any kind of a venture like this? I mean, are we simply?
I'm sure we will be getting some kind of insurances.
Are we
like-
simply the building owner and there's a, Fred, you understand? what I'm
I
saying?
would imagine you would be the landlord.
Just am I saying it right, Fred, or?
Well, it's going to come down to how involved we are with the tenant, so to speak. For example, if you have an indigent care program, and then you also have some other functionality with the tenant, then you're going to be more intertwined and you're going to need more coverage. But in the grand scheme of things, as it is right now, where there is not a tenant, you can look at it as simply being a commercial landlord.
Mhm.
Well, you must have some kind of a thing in place right now for the voucher program, I would think.
We've always carried insurance.
Do you have anything in place for the voucher program at this time? An insurance plan of some kind?
I thought you said indigent. We have the
No, no.
network. Answer, as far as I know, no. Ms. Wood?
Our company will have their own insurance for medical malpractice and of course, a liability insurance for the building and so on, which would be a traditional tenant would have. Unless you are actively involved in the medical practice in some way, I don't see that affecting you.
How long have you been in business in the type of organization, service organization that you were proposing to do?
The management plan that I'm suggesting is brand new. We don't have any experience in it. We are just picking that up from elsewhere and hoping to implement it here. We have no experience with that.
How involved will each of the principals of the organization be in the operation of the hospital?
It's primarily going to be 3 or 4 people. And Ganesh here is going to be involved within the radiology aspect of it. I would be involved. Most of the financial elements would be coming from me. And there is a company that we work with who would be providing us with the infrastructure on the financing and private equity financing and so on.
That kind of goes into my next question. Would you be able and willing to show, I guess that's kind of with his as well, show evidence of insurance?
Evidence of insurance would be after we get it.
Right.
We will of course provide you with insurance coverage. Is that what you're looking for?
Then
Yeah.
you'll be insured as our tenant. That's
Yes,
for everything.
yes.
Okay.
And we would also have medical malpractice liability insurance and the whole 9 yards.
And if selected to go forward and negotiate a contract with the hospital authority, would you be willing to provide evidence of the operating capital that?
Yes. I think I outlined that in my proposal.
Okay.
Yeah, and we will be able to provide support for that.
Doctor. The physicians that we presently are using with our program, their primary care, would they be on staff at your facility, or how would you handle that?
We would be offering everybody who is here first the opportunity to participate with us and work with us. Once, if they reject us, then we would go for others. But the first option would always be local. We will try to get all the local doctors involved.
So the doctors that have been practicing at this hospital would be welcome.
Yes, I mean, our goal would be to engage them as much as possible. We have no intention of replacing any of those people, especially the primary care network, I think is extraordinarily important for the success of a project like this. And I think the more people we can get involved in this will be better for us.
Are there any other questions from the trustees or staff?
We had a question in the beginning, Lydia.
Yeah, but you just get one from the board members now. Okay.
I didn't forget it.
Mr. Powell,
Yes, sir.
What is the corporate structure of, and to us, it's Panacea. It's not whatever you call it. What's your corporate structure?
I need a little
Of the-
elaboration.
Okay, the Panacea organization, is it a corporation or
It will soon be a C corporation.
Okay.
It is currently an LLC. We are currently discussing with the financial planners because now initially we started with one location. This is going to now have 5 or 6 locations. So they are at this point designing to convert it to a C corporation. And it will of course have each individual cost center. And each place will have its own vice president.
So who right now are the principals in the corporation?
We have 3 principals in the corporation. Is that ownership? Is that what you're talking about?
Yes.
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 It is basically me, my son, and I have one more person that is going to invest into this.
Thank you.
I shouldn't say me. It's her. Okay,
I know that. My wife too. so.
my boss. All right.
any other questions from trustees or staff? And at this time, we'll open up for comments and public input. I would prefer if any questions are addressed to the board, and then the board can ask for feedback from the presenters. And this is, again, a time for comments on what the community would like to see the hospital be, and anything about this presentation as well. Ms. Limbley?
Yes, my question, has this team ever operated a hospital before?
No. Well, I should say I was a medical director for a small rural hospital. I don't know if that counts.
I have several questions, Brandon. Why did this operation decide to pursue operating this in Lake City? How were you made aware that you already was looking for a potential person to lease the building?
I don't quite understand the question,
How
but
did you know that this was going to be
oh,
available?
it's in the newspapers. I was, like I told you in my introduction, I don't know if you heard that, we were actually looking into this area long before this happened. And for over a past couple of years, we have been looking to start rural health centers in the vicinity.
Okay. If, again, Brandon, another question. If the foreign provider could not make a profitable operation, what gives you reason to believe that Panacea could make this a profitable operation?
I think I can answer that. A hospital comes with several responsibilities. One of them is that they have to have a emergency room open 24 hours and they have to staff it. They also need to have the ability to take every person that comes through the door and pay for their care. So you could have 10 non-paying patients come through the door. They cannot reject any one of them, and they have to provide all the services at their expense. And typically in many situations, for small hospitals, that becomes a challenge. In a bigger hospital like Advent or other systems, they're able to absorb that because they have a large volume of other patients coming in. In a smaller hospital, when a huge portion of non-paying patients come in, it becomes a challenge. Two, doctors that come into the system, they also look for facilities that are able to support them and give something back in return. And in smaller facilities, a lot of doctors don't see a benefit in going to the facilities. Therefore, staffing becomes a challenge. Specialists. In rural areas, it's especially challenging to bring in specialists because they don't see a future. They don't see a volume. And specialties generate a lot more income than primary care. And for those reasons, it is very difficult for a hospital to survive from a budgetary standpoint. What we are proposing here is we will, while we take the voucher program, we are not obligated to dispense anything for free. We may choose to do that at our own will.
What do you mean you're not obligated?
We are not obligated to treat anybody in the facility without payment. We can do so for participation in the community. So it doesn't obligate us to keep an emergency room open for 24 hours. We don't have to staff it for 24 hours. We can actually staff it to catering to our need. That cuts down our operational costs substantially. And that makes it feasible.
But you can't refuse treatment to someone. that-
No, we won't refuse treatment. What I meant was that we will not refuse treatment if somebody comes. But having said that, we do not fall under the category of a hospital where they have to do that.
Okay, Brandon, I have another question. You answered some of my questions already. The former provider indicated that the ER was troubling because people would come from out of the county to care less whether or not they paid the bill. And do you foresee a lot of patients coming that can't?
You realize that we are not proposing a ER. Our entire presentation, we are not proposing an emergency room.
So you just have a walk-in clinic.
Urgent care clinic.
If someone comes in bad shape, you could say, I'm not quick to handle you, you need to leave.
If somebody comes in an emergency, our obligation will be to stabilize the patient and transfer them to the nearest facility.
Okay. Brandon, I have another question. You indicated in your material, an imaging center. Where did you obtain the information that Columbia County lags behind at 40% on mammography?
Online, ma'am.
Online. Okay.
County statistics.
Okay. One of the other most important things, because I'm a taxpayer, you talk about adding specialties, which is, important. And you talk about the OB unit, and Dr. Thompson indicated this very well, is that purpose of the authority is for indigent care. Doesn't have anything to do about birthing children. And a lot of people were concerned when Chan's closed, they have no place to have their babies. And countless times the person from CHS would come over here and talk about the birthing unit. Most of the babies that were born there were Medicaid. And I had my children 40 years ago when they were both born in Gainesville. So how do you expect to survive a OB unit?
Well, we will go in phases and we would be developing it as the patients coming in, and we will only take things that we can handle.
Okay, Brandon, another question. Sources of funding, what happens if your funding falls through?
Like any other business, we'll fold up. I don't know what the question is, but we are going to provide enough funding to support the operation until it becomes profitable.
And also in the material you presented, you talked about the expense possibly up to $10 million, but you want the authority to assume part of that.
Yes.
I like the idea of your health membership. I thought that was a good idea. And then you mentioned physician recruitment. That was a problem for CHS when they had the facility.
Mhm.
You know, they actually, I think, bought practices to ensure physicians. And what do you think you could do to make physicians want to come here and practice?
Pay them more money.
But you were asking the authority to.
In the beginning phases, I think even in our practices, in private practices, when we recruit physicians, there is an expense to it. Typically, a lot of these physician recruiters will charge us for bringing physicians into the practice. In a startup operation, it will be good to have these physicians because they will bring patients. So I think there's going to be an initial expense in bringing doctors in. Any facility is going to be just as good as the doctors you bring in. So if you want quality physicians to come into the community, that's an investment.
Brandon, another question. Back in the 80s, the Lakeshore Hospital Authority trustees decided to get out of the actual operation of the hospital because of the associated cost. And the board did not want to further burden the taxpayers. And public comments, I as a taxpayer do not wish to continue paying ad valorem taxes to support this building. And, I think you've got, great idea, but I don't think the authority needs to subsidize your for-profit operation.
That's for the authority to decide.
I got a question. Yeah, are you done? I'm sorry.
Yeah.
Great question, by the way. You want to go?
No, go ahead.
I'm gonna be a little long.
Well, you take as long as you want. I might not have to say a word. It'll cover everything.
So I don't have any post-high school education, so I'm gonna take my time and hope you be patient with me. My first issue would be that you don't have any hospital ownership experience, and that comes off extremely troubling because a lot of the people that would be entering in that hospital would look like me, be from the same community in which I'm in. And some of the things that we're greatly concerned about, this is the area you're going to be serving, which is District 10, mostly in some of 5 points. And so our concerns is a emergency room. A lot of things happen over there, gunshots, people get stabbed, police is, doing certain things to get citizens and whatnot, and you won't be able to sustain it. So if we're playing baseball, that's strike one. And you said that you would have to do the baby and delivery and certain things in phases, right? Well, we have babies a lot. And so I don't know whether or not we have time to wait until you get to a certain point. And so in baseball, that's strike 2. And so I'm concerned about whether or not you have the financial means because, you remind me of a neighborhood store. And in a neighborhood store, they're not licensed to be a store, but they're selling soda pop, they're selling candy and whatnot, as if they are. And the problem with that, and why I say it, is because you want to subsidize it with the ALF. You want to do other workaround things to build up revenue. That's not traditional when it comes to a hospital. Most hospitals, they come in fully staffed, fully funded. So that would be strike 3. And so you're not that anymore. And I say that as a concerned citizen, for not only myself, but the community that would have to come into this facility. I just don't think, I think it's a great idea. I think it's a great idea what you're pitching, but I just don't think that this is the right community for it. I don't think that this, and I understand your arrogance about the authority beside. No. The community decides what they want, and I would think and hope that the authority will support the community in what they would want. But I think the authority speaks and serves for the community in which this hospital would be served. And I just don't believe that you're offering the things that the community would need. You're no different than Baylor Walk-in Clinic with some extra services. And therefore, in my opinion, as far as myself, predominantly Black community, you struck out, sir.
Thank you, Mr. Chairman. I'll be brief. Everybody knows most of what I have to say. First of all, thank you for coming. I enjoyed your presentation. Thank you for coming to America for your education. Nice thing. I don't know if you've read the enabling legislation of the Lakeshore Hospital Authority. If you haven't, you should probably get a copy. In 2005, the final one that they did. And in that legislation, it says that the primary purpose of the Lakeshore Hospital Authority, so these folks know it, they have dreams about other stuff, a little Democrat at the end, other folks. But the primary purpose of the Lakeshore Hospital Authority in the Florida legislation is to provide indigent care to the residents of Columbia County and a couple of other things. That's the purpose. So I listened carefully and took some notes. And it says you want to provide OB, cardiac, radiology, and other things, oncology. All those things would be a full service, provided in a full service hospital. Clearly, it's America. You can build whatever hospital you want right now. I personally believe since 1962 in single payer, but America doesn't believe in that, as you well know. So, considering that all you need to do is provide indigent care, all the other stuff is good for a hospital, maybe good for the community. But you're not required, and the board knows that, you're not required to provide any of those other services. You're just required to service indigent care patients. Presently, if you don't know, the hospital authority is down to like 100 clients or 115 clients. That's pretty much nobody. In your world, that's not going to pay your bills for a long time. There was a time when the hospital authority had over 1,000 clients and one staff member and no paid executive director. And it seemed to work just fine. That's when they were affiliated with Shands. If you haven't spoken to the folks at Shands, you spoke to Denby, you should speak to them about that. The biggest problem at that time, as it is now, was maintenance in the hospital. Now we all know that the hospital wasn't maintained. It needs a minimum of $10 million worth of repairs. So here's my question. CHS, who is a big hospital operator, said in their final reporting study, one of them, Mr. Williams can certainly attest to that Columbia County only needed one full service hospital. That's what they said. They may not be right, but that's what they said in that study.
Can you repeat that? Who said that?
CHS said that. I mean, they're right. That's what they said. Lake City only needs one full service hospital. Lake City Medical Center right now, as you well know, is doing an expansion. I would like you to come here and whatever services you provide, that's what you provide. And if you could provide indigent care, you may be nothing more than just another clinic. But with 100 clients right now, and Lake City Medical Center, which is part of, I get all the letters confused, so one of those letters, 3 letters. HCA, thank you, which is a multi-bazillion dollar corporation. And I would respectfully point out to you, and I'm done, that as far as charging goes, they're one of the highest charging hospitals in America. In a recent study, Ms. Chancey is shaking her head, yes. They really charge. sometimes 2,000% more than other hospitals. So I'm glad that you are doing this, and I write stories. And I hope that you're successful in whatever it is you work out with the board. But I suggest you look at the history. If you want to open up, and we've discussed this, I've discussed this with other people, if this community needs an emergency clinic, urgent care, and some people believe it needs OBGYN. Although I don't know, because, and my final question is, have you folks have the statistics on how much indigent care was coming through the hospital? Because if you have only 100 clients now, I gotta tell you, that's not really a good business model. It's like open a car wash and you only got 100 cars coming through. So I don't know how many clients you would have that are having babies. Mr. Warren said folks have babies, and we know that they do. But I don't know if it's enough to support a whole hospital. Clearly, that's a decision that's not for me to make, for Mr. Warren. That's your decision to make. And the other services that people in the community get, but it's for indigent care. My understanding is Mr. Warren is concerned about indigent care. I may be wrong, this is concerned about, and care in the community, folks that don't have indigent care. But the purpose is indigent care. So I think that's something you need to consider. And if you've done the statistics on how many of these services that you're looking to provide would be to indigent care patients, I would like to know what they are. Not a trick question. If you don't know, that's fine.
No, I can.
Yes, sir.
You may not like the answer, but I will. One of the things that I presented, whatever the board decides, we are going to honor their voucher program. We are going to honor their voucher program and take care of those patients.
Right.
Now, they can put 1,000 people there, 2,000 people there, we are going to honor that. Okay, so we are willing to provide indigent care through their voucher program. So this thing about not providing indigent care is not right. We are offering that.
No, that's fine.
Now, the only thing we are not offering, this is a hospital that's shut down. So it's no longer a hospital. So therefore, it doesn't have an emergency room as such. We don't even have a license to be an emergency room at this point. Even if you like to have an emergency room, it takes several steps before you can even get back there. Okay, I think the hospital authority has explored that. And it is a phased, very expensive, prolonged process. We can help you get there, but again, in a good model, you have to have revenue producing centers to support indigent care. To do away with revenue producing centers, either based on a philosophy or a belief, will basically jeopardize the provision of indigent care. So you have to have some revenue centers to be able to do the rest of it. So my proposal shows, what I'm trying to do here is to build revenue centers that will help provide this care. Okay, does that answer your question?
Thank you very much.
I have another question, Brandon. You mentioned memory care. Is it possible to use the current facility and have, say, 66 beds of memory care?
Of course.
And that would be a good revenue stream.
Yes, ma'am.
Because it seems like that is a
Yes, definitely.
digressing situation with people being.
Well, it all, you have the liberty to make a choice what you want. This is one plan. This is not the only plan. If you have other things that you want to look into, definitely, I think you should.
But, as Mr. Walker stated, and Mr. Thompson, Dr. Thompson said, the board will knows the purpose of the authority is to provide.
And again, I repeat this, we are going to accept the voucher program like it is designed and intended to. So we are not going or walking away from that.
Oh, no, I understand.
Okay.
I just want to let you know is that purpose of the board is here. Other things develop, fine, but, we're not responsible. The board and taxpayers aren't responsible.
And if I may, I want to just say this. I'm an immigrant that came here many years ago, and I trained in Harlem Hospital. And I have had the opportunities that this country has provided to stand before you today, where I am. And one of the things I've learned along the way is that we were going many years ago from Ocala, we would have these charity trips to Haiti, to South America, to China, to help people who are in some other country. And I would be invited on these trips on many occasions to go there and help these people. When I went to Williston, which is about 25 miles away from where I live, they have no basic medical services. And one of the reasons I even took this path was I thought that maybe this is a calling for me to give something back for a country that has given me so much. And even though part of it is business, part of it is also to give back to the community that has given me so much. And in a good business plan, you have to have revenue generating centers. And then you can do charity. Like how when a plane crashes, they will ask you to put your mask first and then save the next person.
Yeah.
Okay, no. What I'm saying is that I think it is very important to have a good business plan where we are able to provide for providing indigent care as well as whatever care you want to call it. But you need to have some game plan where it's not going to be entirely come from somewhere. Okay, that's all I'm going to say.
Yeah, I'm touched by the fact that you're an immigrant and this country has been good to you. I'm a descendant of slaves. And so this country, I don't share the same sentiment that you share with this country and you. So let me say this, though I appreciate all that you're saying, right? So with me, as a descendant of slaves in the United States and the situation of my community and the Black communities, don't know whether or not, I know your skin complexion is similar to mine, but you're not African American as they label us. So it's a difference, right? And so I'm concerned about making sure that people who look like me, descendants of slaves like me, that they're gonna get the best care possible and making sure that we're not gonna have a hospital that promises a whole lot, delivers a whole little, and that the services are gonna be able to be sustained. And you not having any hospital experience, and I see the way that you, and by the way, though I don't have any post-high school education, I'm an entrepreneur too. So I understand the structure. Mr. Powell, I got my own CPAs. So I understand the structure of business, right? I'm not ignorant to finances and things of that sort. And I understand what you're trying to do. You're hustling, you're a businessman. So you want to do this, first time doing it, you want to do it. So you're going to try to make it work financially. You got so much money you can borrow, right? You got so much money you can get from other people. And you got so much money you got to try to make with subsidizing the hospital with memory care, ALS and stuff. I get that, right? But that's not what the community needs. The community needs somebody that's gonna come in and give them the full services that they need, not a desire of you trying to get to a point that you want to get to. Does it make sense?
Yes, it does. And I'll never be in your shoes, but if there's a better way to do this, we are willing to engage in that.
With me, but I'm
Okay.
gonna be honest with you.
No, I'm being honest too. What I'm saying is that if there's a better way to do this, we will be happy to engage in that. Okay, at the same time, I think that we are going to serve the indigent according to the voucher program that they have. I think that is the point I'm trying to make, is that we are not going to do away with it. The hospital doesn't exist anymore, therefore the ER doesn't exist. So, and I think it will be a long process before you can get back there.
Well, it's unfortunate because I don't think the community has a long time to wait, but and I understand that's not your fault. Things happen prior to you with the hospital, so I'm not blaming you for that. I'm just only interacting with you based on your post.
Doctor,
Yes, ma'am.
I think it's important that in your plan, you say that you will have like 24 or 36 hour stay after like
Uh,
procedure that can be done in that period of time versus being hospitalized somewhere else?
Well, that is, I cannot say that right now because it is not passed yet. It is on the state legislature floor to allow it. We are not at that stage where we can say that, yes, this patient can stay here. There are certain facilities that are going to be certified for a 24-hour stay. And like I said, that's not going to happen right in the beginning. It'll probably something that will happen in 2 years from now.
But that would be something that would help the community.
Yeah, it reminds me of when I was doing Fed times, when we get ready to go to medical, hurry up and wait.
Yeah.
So,
That's the government.
yeah, I mean, and that's just been the attitude of this country and proposals as it relates to poor people and the Black communities. Hey, if we take this, this is all we got to offer you, be patient with us, it may or may not happen. So I just think that other people deserve quality hospital, quality care as fast as other people do. It may be more high on the social level and social class and financial class as other people. That's just me. I'm good.
We agree with you.
And during phase one of the urgent care center, you say 4 days a week, 12 hours a day.
We
and
will go to a full 7 days a week.
So, and you may find out, I know you know statistics about this much better than I do, but if you see that 10 to 10, 10 a.m. to 10 p.m. would be a better time, I mean, you're flexible to change that
Yes.
time and expand that time in the days.
Yes, definitely.
What happens when somebody gets sick at 10:01?
Same thing that happens now, unfortunately, I have to go
Elsewhere.
to the medical center. And I guess that's the thing, is we do have more presenters at a later date, but I don't know that we're gonna have, somebody come in and say, hey, we're gonna open the hospital up and it's gonna be fully functional on day one.
Yeah, I mean, I agree with that. I just don't want it to be years later. And two, I just don't want the authority board to be so, because I have run a property, I'm a landlord as well, and I hate having vacancy. I don't want us to be so to the point where we're trying to fill that vacancy that the community doesn't get what they need.
Right.
Because, landlords are trying to rent out their commercial space. So,
Are there any other questions or comments from the trustees or anybody else from the community that's would like to speak? Anybody that's called in on Zoom that would like to address the board? Reminder, if you're called in, you press *9 on your phone to raise your hand. *6 to unmute. Last opportunity for the trustees or staff. Here none, I'll entertain a motion for adjournment.
Motion with that.
Second.
A motion and a second. Thank you all.